Ayurveda physician at Agni Hospital in Surat. He's also senior international consultant for Jiva Ayurveda Private Limited, and also international panel for consultancy in Easy Ayurveda Private Limited. Main area of practice is Panchakarma, difficult to treat cases in ICU, severe septicemia, cancer, and autoimmune disease, neurodegenerative disorders, skin disorders, ENT and ophthalmology, stroke paralysis, rehabilitation, infertility, muscle, bone, joint disorders, regenerating therapies, geriatrics alignments, and the hormonal disease. These are the specialty of his treatment. He has been treated highest number of cases of mucormycosis, which is commonly known as a black fungus in India. More than the 1,500 cases he has been successfully treated with just treatment of Ayurveda. He has published total 8 cases like necrosed esophagus and standalone management of the left lobe pulmonary mucormycosis, management of the blepharospasm, management of cholecysthiasis, management of the cervical canal stenosis, management of complication of post-traumatic subarachnoid hemorrhage, management of necrotizing wound, management of Aspergillus niger. All this kind of case study is presented in Ayurcell project that is supported and funded by Ministry of Ayush. Now, I'm not taking much time, and I requested to Dr. Rajnikant Patel sir to give.
Thank you very much, Dr. Dhruv Trivedi, for this brief about today's class. And namaste and good evening to all the doctors and Vaidya from all around the India. So let's start. Okay, is it visible, no, Dhruv?
जी सर, क्लियर क्लियर
आवाज भी आ रही है ना सही से?
हाँ, आवाज भी आ रही है, स्लाइड भी विजिबल.
Okay, so Ayurveda and multiple sclerosis. Okay, so we can see in the pictures that I have used the photo of neuron in the main beginning slide. So we have to understand that all this disease has to do very much important thing in terms of health of the neurons. So we will be discussing about how neuron structure is there normally, what happens when a patient is having multiple sclerosis to their neurons. So these all things we will be discussing in the this class. So this is the main slogan which we must keep in our mind in this 21st century, in the time of modern medicine. So thousands of years of human observation and trial and error are far more greater than the 6 months of experiments in the lab. So we generally falls in the trap of this modern research paper, and they will be coming up with some data, and they will say we have tested this medicine on lab animal and it is showing a promising result. So we have to use in the this human. Okay. But when we see the total amount of animal or living being on which they have applied this the thing is very few. But when we compare it with, I think all the participants should mute their mic because it is disturbing. So when we compare it with Ayurveda, our Acharya has done trial and error for thousands of years. It is not like that they have applied some principle of Tridosha or they have applied the theory of Srotas on 100 or 200 animals or 1000 animals, and whatever they have find, they have written on this thing. It is not like that. So our Acharya has built the theory. They have practically implanted it on many human beings. Even they have did trial and error, and whatever they have benefited or whatever the conclusion was there, it is written in the form of Samhita in the Sanskrit language. Okay. So we must respect our Samhita and Shastra. Ayurveda, according to Acharya Taraka, is Shashwat. Unless and until there is a moon and sun in this universe, the rules and theory of Ayurveda will be true. There is no doubt in it. So we must respect our Samhita. All the theory, all the principle which is written in Ayurveda is 101% sure. If we think it is not relevant to modern time, it is our fault. We have to think over it. Okay. Now let's go into the topic. So multiple sclerosis is a autoimmune disease which is complex in nature and it affects the central nervous system, particularly the brain and spinal cord. So the name itself suggests here that multiple sclerosis. So what is sclerosis? Sclerosis is like a scar tissue or when the neurons are getting damaged due to the demyelination process in the nervous system, that is in the brain and in the spinal cord. Once that a specific area is getting damaged, it will become a dead area and it will make a sclerosis type of thing. Now this will be more in number. So it is called multiple sclerosis. Okay. So it is autoimmune disease that is important. It affects the central nervous system and in that it will affect only brain and spinal cord. The majority of the cases will be having lesion in the brain and spinal cord. Peripheral nerve involvement will be very rare. Okay. So it is clear multiple sclerosis autoimmune disease है और ये सेंट्रल नर्वस सिस्टम का डिसऑर्डर है और ब्रेन और स्पाइनल कोड में ही होता है और एक से ज्यादा लीजन हमको दिखते हैं इसलिए इसको मल्टीपल स्क्लेरोसिस बोलते हैं. ओके. Okay. So we have seen in the first slide that this disease has to do all the thing with neurons. So we must know what happens in the body when a person is affected or the person is having multiple sclerosis. So in the screen, you can see neurons is shown and the different parts of neurons is there: axon, nucleus, neuralema, myelin sheath and sternum cell. The most important part on which we have to focus in the multiple sclerosis is myelin sheath because this is getting disrupted, so the multiple sclerosis happening. So what happens when the person is having multiple sclerosis? So the immune system will attack the protective sheath, which is also called a myelin, that covers the nerve fiber and cause communication problem in between your brain to the body, vice versa, from brain to body and from body to brain. So the myelin sheath, you can see the myelin sheath, which is made up of phospholipid. This will be damaged due to the autoimmune response generated due to several factors. Now, due to the damage of the myelin sheath, there will be an issue in conduction of the nerve, this electrical signal in the neurons. Okay, so it is very clear. Now, what are the causes and pathology? So, autoimmune attack, myelin damage, and lesion. These are the three parts. So, first, there will be an autoimmune mechanism getting generated in the spinal cord and brain. So, in this, immune system mistakenly targets the protective myelin sheath which is surrounding the nerve fiber. Now, due to this attack, this leads to the inflammation and damage of the myelin sheath, which is very much crucial for transporting or for the neuron signal to travel. So this, once damaged, it will disrupt the nerve signal transmission, and this is the main place where the disease starts. So this is the place where all the samprapti is getting surfaced. Now the damaged lesion results in the various neurological symptoms. Because myelin sheath is damaged, there is no proper traveling of the neural signal. So the neurological symptoms all over the body will be getting affected gradually in the patients of multiple sclerosis. So symptoms. So there is no single group of signs or symptoms which is entirely diagnostic of multiple sclerosis. This is very much important in this thing. When we look for Alzheimer, when we look for this Parkinson, or when we look for any other neurological this disease, they have the specific set of signs or symptoms. Based on that, we can diagnose the disease. But in the case of multiple sclerosis, it is very much difficult because there is no single group of sign or symptom which all patients will be having similar. Despite of this, the disease is oftenly recognizable on the clinical ground. Okay. So there is two main pattern of MS. One is relapsing and remitting multiple sclerosis, and another one is primary progressive type of multiple sclerosis. So what is relapsing and remitting multiple sclerosis? For example, if patient is diagnosed with multiple sclerosis in 1 month now, so patient will be having all the complaint of giddiness, disturbed gait, optic nerve related issue, vision related issue. Now once the patient takes medicine, patient start taking medicine, he will be all right, and after a few days he will be completely asymptomatic. He will be 100% clinically improved. So it is called a remission of multiple sclerosis. Now, after few days, on when there is a proper favorable atmosphere in the body for this, it will again reoccur. So that is called relapsing of the multiple sclerosis. In majority of the patient, it starts relapsing from the orbital symptoms. So this is the majority of the patient of multiple sclerosis all around the world presents with these types of feature, that is relapsing and remitting which is 20% of case, or we can say less or equal to the 20% of case, which is continuously progressing. Most of the MS case will be relapsing and remitting in the nature. And we have also told what is relapsing and what is remission. Okay. So how to diagnose this disease in the modern science? So MRI is the ultimate tool to get diagnosed with this disease. So MRI brain and spinal cord is the first line of investigation to see the multiple plaques. And this will be visible principally in the periventricular region. So we can see the ring enhancing lesion in the brain. We can also see the lesion in the spinal cord that I will be showing in the coming slide. Okay, so there, in majority of the disease, the future course or the how the disease will behave in future, that is data. The science has a data. For example, in Parkinson, what will happen in future? In Alzheimer, what will happen in future? Or in any other neurodegenerative. So there is a prediction. There is a predictable disease. Other, but in when we talk about multiple sclerosis, we cannot predict the course of multiple sclerosis. This is the very danger thing about this disease. We cannot say what kind of future this patient will have, what kind of situation of life this patient will be having after 2 months or after 2 years. So in this disease, there is a no method of predicting the course of multiple sclerosis. Even we cannot say that when the disease will go into the remission and when it will relapse. Okay. Uh, when we talk about medicine for this multiple sclerosis in modern science, so no absolute medicine is available, but corticosteroid has a great role in the managing of the symptoms when there is a relapsing this multiple sclerosis. So use of corticosteroid in the relapsing condition will help to reduce the inflammation and will help to recover the patient symptomatically in the given time. But it doesn't mean the corticosteroid is the ultimate treatment because they do not influence the long-term outcome. So this is the very important. Only corticosteroid is available. Now the corticosteroid is given when there is a relapsing condition. When it is given, it will reduce the inflammatory changes in the nervous system and it will most of the patient after taking corticosteroid recover from their clinical issue in the just few days. Then they will go into the remission stage. Then again, relapsing stage occurs, they will have to take corticosteroid. So this is the only treatment which is written in the clinical textbook of modern science. There is no other molecule written in the textbook of this modern medicine, clinical medicine. Corticosteroid, of course, it is a very good medicine and has to be used when there is a relapse of the multiple sclerosis. Now, the modern science and FDA has approved one content from this our Ayurvedic medicine that is Parpataka. So the one of the main ingredient, this chemical constituent from the Parpataka dravya is now the best main treatment used in the European Union. Or you see the Western country, they are using one medicine. I forget the name, but I think you may search Parpataka. One of the chemical of Parpataka of our Ayurveda is now they are using in the multiple sclerosis, and it is approved by the Food and Drug Administration in the USA. So this we should have research in India about this particular role in the multiple sclerosis in reducing the demyelination process. Okay, so now we have seen briefly about what multiple sclerosis according to modern science, what are the symptoms, how to diagnose, what are the treatment available. That is very limited, only corticosteroid. Okay. So now our main topic of discussion, how Ayurveda looks in the multiple sclerosis, where exactly we can see the explanation of multiple sclerosis or the condition like multiple sclerosis has been given in the Ayurveda. So there is no exact disease which is similar to multiple sclerosis in Ayurveda. That is important. We have to use our yukti. We have to see the dose, dhatu and shrotas and all the vyadhi to see which disease we can exactly correlate with multiple sclerosis. All these things we will be discussing in the coming slides. It is important to understand the disease pathology in order to understand the Ayurvedic perspective of multiple sclerosis. So as discussed earlier, myelin is a protein and a fatty substance that surrounds the and protects the nerve fiber. So myelin sheath जो कि प्रोटीन और फैटी सब्सटेंस से बनी हुई होती है और नर्व फाइबर को प्रोटेक्ट करती है, उसका फाइबर है, कवर है. In the multiple sclerosis, the immune system attacks the myelin sheath, which becomes destroyed in many areas. This is clear. We already discussed. This is the pathophysiology. Now, this loss of myelin, it forms the scar tissue called sclerosis, and this area are also called a plaque or lesion. In earlier time, it was called plaque or lesion. Now, in modern time, they are labeling it as a sclerosis, and it is more in number in the brain and spinal cord. So the disease is termed as multiple sclerosis. So this area are also called plaques or lesion. When the nerves are damaged in this way, they cannot conduct the electrical impulse normally to and from the brain. This is the main area where we need to focus. So we can say that quality of myelin sheath affect how fast the signal travel through the nerve cell. Okay. So whole funda in this disease is nerve signal is not able to travel from one neuron to another neuron and the complex of neuron. So this we can have a look in the Vyana Vayu Karma. According to Ashtanga, we know that Vyano Radi Avastita Sharire Vanacharan. So the Vyana Vayu main site is heart, and it is the one Vayu which is moving all around the body in the circulation. Or the circulation or any transportation in the body, Vyana Vayu is the solely responsible. We also know the slok of Pittam Pangu Kapha Pangu Pangu Malat Atavaha Vayuna Yatra Niyantrati Tatra Gachati Megavata. So Pitta and Kapha are immovable, they cannot move by themselves. All the seven dhatu, they also immovable, they cannot move by themselves. All the three Mala, Purish, Swet, Mutra are unmovable. Only with help of Vayu it is able to move. Now in the Vayu also we have five Vayu, Pran, Udan, Vyan, Saman, Apan. In this, Vyan Vayu is the main responsible Vayu or the responsible force which helps to travel any body material throughout the body. Whether you take plasma, you take a hormone traveling from brain to other parts of body. The stool is traveling from this anulom gati of stool, anulom gati of mutra, perspiration, anything which is moving in the body, it is the Vyan Vayu is the responsible. The healthiest quality of Vyan Vayu a person have, the healthiest circulation the person have. So we'll be seeing the Vyan Vayu karma in detail in the coming slide. So majority of the myelin sheath is made up of lipid. This is the main treatment. Our treatment will be focused based on this principle that myelin sheath is made up of lipid. तो माइलिन शीथ का ज्यादातर हिस्सा जो है वो चर्बी से बना हुआ होता है, लिपिड से बना हुआ होता है, ठीक है. और यही चीज इस बीमारी में डैमेज होती है ऑटो इम्यून रिस्पॉन्स के कारण. और डैमेज हुई माइलिन शीथ की वजह से एक न्यूरॉन दूसरे न्यूरॉन के पास सिग्नल नहीं भेज सकता है. ये एकदम सिंपल अंडरस्टैंडिंग है. न्यूरॉन्स का एनाटॉमी हमको पता है और सब उसमें रहता है. उसका जो रेन्यूअर्स नोड जो है उसके ऊपर माइलिन शीथ रहती है. और माइलिन शीथ लिपिड की बनी हुई होती है। अब ऑटो इम्यून रिस्पॉन्स के कारण बॉडी नर्वस सिस्टम खुद अपने माइलिन शीथ को डैमेज करता है और इसको डीमाइलिनेशन बोलते हैं। और इसकी वजह से एक न्यूरॉन से दूसरे न्यूरॉन को केमिकल सिग्नल जो सॉरी इलेक्ट्रिकल सिग्नल जो भेजना है वो अच्छी तरीके से नहीं भेजा जाता और इसी की वजह से पूरे न्यूरोलॉजिकल सिम्टम्स आते हैं। तो हमको आयुर्वेद से क्या करना है? इट इज वेरी इजी। वी हैव टू मेक अ माइलिन शीथ स्ट्रॉन्गर सो दैट न्यूरॉन जो है वो अपने इलेक्ट्रिक सिग्नल इलेक्ट्रिक इम्पल्स को अच्छी तरीके से एक दूसरे न्यूरॉन के पास भेज सके। एकदम आसान है आयुर्वेद के हिसाब से इस बीमारी को समझ। So nervous tissue contains about 50 to 60% of their dry weight as a lipid, and approximately 35 to 40% of these lipids are unsaturated fatty acid, which is also known as PUFAS rich phospholipid. आप देखिए जो नर्व टिश्यू है उसका 50 से 60% भाग जो है उसका ड्राई वेट का वो सिर्फ लिपिड है, सिर्फ लिपिड है। आप अंदाजा लगा सकते हैं कि सेंट्रल नर्वस सिस्टम का 50% भाग सिर्फ और सिर्फ चर्बी है और उसमें भी 35 से 40% जो चर्बी है उसमें से 35 से 40% जो है वो फॉस्फोलिपिड रिच है ना। और आप यकीन मानिए गाय के घी में नेचुरली फॉस्फोलिपिड सबसे ज्यादा होता है। और हमारे इंडिया में हम अक्सर देखते हैं कि जब बच्चा पैदा होता है तो उसको शुरुआती 3-4 साल में माता पिता या उसके पेरेंट्स जो है वो उनको गाय का घी ज्यादा खिलाते हैं। वो हमारे वहां सालों से चला आ रहा है। इसका मतलब यही है कि द मोर एंड मोर काउ घी, बेस्ट क्वालिटी ऑफ काउ घी इफ वी गिव टू न्यू बॉर्न चिल्ड्रन आफ्टर 6 to 8 months of their life up to 4 to 5 years, we can build the healthiest quality of myelin sheath or the healthiest the central nervous system, because cow ghee has natural phospholipid in it, and in multiple sclerosis this area is getting damaged. So just if we give cow ghee to the multiple sclerosis patient, we may see the good improvement, because we have a rule in Ayurveda, sarvada sarva bhavanam samanyam vruddhi karanam. Fat is deficiency is there in the nervous system, provide the fat. Okay. So we all know Ras, Rakt, Mas, Med, Asti, Majja, and in our college, our professor teaches us that Rasa is a plasma, Rakta is blood, Mas is muscle tissue, Med is adipose tissue, Asti is bone, Majja is marrow, Shukra is reproductive system. Okay. So that is perfect. That we all learn in the college. But when if we see the Shabda Kalpadruma, that is the Sanskrit dictionary, it is a classical textbook. So what the word Majja means? Majja means bone marrow. That we all learned in the college, and that is what we know till now, that Majja is the bone marrow. But what is the meaning of word Majja? In the Shabda Kalpadruma, it is given that any material, anything which is there inside the bony cavity, it is called a Majja. It is clear. Of course, bone marrow is there inside the bone, so we are calling it as a Majja. But brain tissue and spinal cord is also Majja. According to this principle, anything which is there in the bony cavity is called a Majja. So we have brain in the bony skull, we have the spinal cord in the vertebral column. So skull is a bone, brain inside the bone, that is a Majja. Spinal cord, vertebral column is a bone, spinal cord inside it, it is Majja. So it is clear, the tissue or the gray matter or white matter or anything we say, we can say brain and spinal cord is a form of Majja Dhatu. So in multiple sclerosis, Majja Dhatu Kshay is happening. Sarvada Sarva Bhavanam Samanya Buddhi Karanam, we have to give the good quality of Majja Dhatu so the deficiency can be fulfilled. So according to me, this is how I understood this disease, and this is based on this principle I am doing the treatment and seeing the good results. Okay, so this is very clear. Now, further going deeper in the subject of Majja Dhatu and brain and spinal cord. So, Acharya Chakrapani comments on these issues. He says that Mastishkam Shirohastha Majja. So, मस्तिष्क जो है वो शिरा में रहता हुआ मज्जा धातु है. The मस्तिष्क or the brain is the Majja Dhatu, which is located in the Shira Pradesh. So the Majja Dhatu located in the head inside the bony skull, it is nothing but Majja Dhatu, and that is a brain, gray matter and white matter. Okay. So Hindu Tika also says the same thing. Med Dhatu turns into the Mastulunga and it also modifies into the Majja. So it is the variety of Majja Dhatu which we have in the brain, inside the brain and spinal cord. So inside the bone marrow, inside the skull, it is a brain. Inside the vertebral column, it is the spinal cord, and inside all the long bone, it is the bone marrow. According to Ayurveda, all these things is same, and it is called a Majja Dhatu. And Majja Dhatu is Avilana uncondensed in the form of Mastulunga or the Mastika, that is brain or in the central nervous system. So this is very clear for all. ये एकदम easy है. जो स्कल के अंदर जो चीज है ब्रेन, उसको मज्जा कहते हैं. वर्टिब्रल कॉलम के अंदर जो स्पाइनल कोड है उसको भी मज्जा कहते हैं. हमारे पास रेफरेंस है क्योंकि जो हड्डी के अंदर जो चीज रहती है उसको मज्जा बोलते हैं शब्द कल्प ध्रुव के अकॉर्डिंग. ओके. Now we all know the multiple sclerosis. In the condition of multiple sclerosis, Majja Dhatu is getting diminished. Okay. So we can take it, so demyelination and neurodegeneration. This principle we can apply in all the neurodegenerative disorder, not only in multiple sclerosis. You take multi-system atrophy, Parkinson, Alzheimer. There are many this disorder, neurodegenerative disorder. Same Majja Dhatu Kshay will be happening due to the neurodegeneration. So Majja Kshay, demyelination or neurodegeneration, we can say is a Majja Kshay. And now Majja Kshay will happen due to what? We all know Dhatu Prakop, Vata Prakopa will lead to the Dhatu Kshay. This we all understand and we very well know. So Vata Prakopa, so person is doing Nidana Sevana for Vata. We all know Vata, we can refer Vata Vyadhi Nidana. In urban area or in the city area where people are having sedentary lifestyle, Vata and Kapha are always on the aggravated mode. So due to the Vata Prakopa, Majja Dhatu Kshay is getting place. And this is how the Nidana and Samprapti starts from here according to Ayurveda. So maintaining the lipid, both quantitatively as well qualitatively, is the essential part of a healthy myelin chain. This is clear. Because unless and until there is if a person don't have a healthy quality of lipid, there won't be a healthy myelin sheath. So in order to maintain a good health of myelin sheath, maintaining of lipid level, not only is quantitatively but qualitatively as well as quantitatively, is the essential part of a healthy myelin sheath. So this is where our Ayurvedic treatment should focus. Okay. Now we have one more reference in Charak Samhita Sutra Sthana Vat Kalakali Adhyay, where Acharya Punarvasu is having debate about quality of Vayu and all these things. Where he says that Vata is Sarva Indriyana Mudyojak. So all the Indriyas function, all the sensory function is purely done by the Prakruta Vayu. And Vayu, we all know, Tatra Ruksha Lagu Sita Kharaha Sukshma Chalanila. This slok we all know. This is the quality of Vayu. But there is two more quality of Vayu which is mentioned in the Charak Sutrasthan 12th chapter. That is Anavasthit and Asangat. That is Amurtaru. So what is Anavasthit? Anavasthit means Vayu cannot be stable. It cannot stay at same place for a same time. So it will be constantly traveling. So that is the Vayu, and it is Asangat or Amurtaru. We cannot see the Vayu in any form. We just have to feel by their function. Now, the best example I will give, we know Panchkarma, in Vamana and Virechana, we have a reference to see whether it is a Hini Shuddhi, Pravara Shuddhi, Uttam Shuddhi. We have to see for Pitta and for Kapha in Vamana and Pitta in the this thing. So, but in Basti, Acharya have not told anything to look for what Vayu. For Vamana and Virechana, they have told to look for Pitta and Kapha at the end of Vamana and Virechana. But in Basti, we don't have a reference to see a Vayu. How to see a Vayu? Whether it is getting proper Anulamana as Pitta and Kapha in Vamana and Virechana? No, because Vayu is Asangat. It is Amukta Rup. We cannot see the Vayu. We cannot do the Sangat. We cannot come in between. We cannot make two part of means like the translation. तो वायु जो है वो अनावस्थित है, एक जगह पे कभी रुकता नहीं है, कॉन्स्टेंटली लाइफ भर एक जगह से दूसरी जगह घूमता रहता है। दूसरा वायु असंगात रूप है, मतलब इसको कोई देख नहीं सकता, इसका कोई रूप नहीं है। हालांकि पित्ता और कफा को देखने के हमको रेफरेंस मिलते हैं वमन और विरेचन के अंदर। बस्ती में हमको कोई रेफरेंस नहीं मिलता कि वायु को कैसे देखा जाए बस्ती के दौरान। तो यहाँ पे एक चीज हम कंफर्म कर सकते हैं कि जो नर्व इम्पल्सेस जो है वही क्वालिटी अनवस्थित और असंगात जो है वो नर्व इम्पल्स के पास भी है। इसका मतलब इस बीमारी को हमको प्योरली वायु की ही चिकित्सा करनी चाहिए और ये हमारे पास शास्त्रोक्त आधार है। तो अनवस्थित एंड असंगात रूप इज व्हाट वी कैन ऑब्जर्व इन द नर्व इम्पल्स। So nerve impulse is the what function of Vayu according to me. So anywhere the nerve impulse or neurological function is getting damaged, we have to solely focus on the Vayu. Of course, if there is associated something, we must focus on Pitta Kapha as well. Okay. So thus, the use of Snehadravya becomes essential part for the treatment of multiple sclerosis. So this is very clear. क्यों हमको स्नेह द्रव्य यूज करना है? हमने मॉडर्न साइंस भी देखा क्या बताता है, हमने आयुर्वेदिक रेफरेंस भी बताया कि इसको स्नेह ही चाहिए मल्टीपल स्क्लेरोसिस को सही करने के लिए। ठीक है, ठीक है। तो हमने मॉडर्न साइंस के बारे में देखा, मल्टीपल स्क्लेरोसिस क्या है, उसको कैसे समझना चाहिए, उसका सिम्टम्स क्या है, कैसे टाइप्स है, रेमिसिंग, रिलैप्सिंग, प्रोग्रेसिव है, उसका इन्वेस्टिगेशन क्या है, तो कि भाई एमआरआई है, उसका ट्रीटमेंट तो कि कोई नहीं है, कोर्टिकोस्टेरॉइड रिलेप्शन में हम इन्फ्लामेशन कम करने के लिए देते हैं। ठीक है, और आयुर्वेद में भी देखा मल्टीपल स्क्लेरोसिस को हम प्रोबेबल कहाँ कोरिलेट कर सकते हैं विथ रेफरेंस। ठीक है, सो नाउ वी विल टेक वन केस स्टडी ऑफ मल्टीपल स्क्लेरोसिस। दिस केस वाज standalone. We have given Ayurveda treatment. This patient didn't receive any modern medicine. So 30-year-old female patient came to our hospital with a complaint of severe giddiness, disturbed gait and slurred speech since 4 to 5 months. She was not having any family history of multiple sclerosis or any other neurodegenerative disorder, and also there was no any comorbidity or any other associated disease. So just after 3 months of Ayurvedic treatment, there was a dramatically improvement which was seen in her clinical issue. So what treatment we have given for this case? So we have given Matra Basti Mahakalyana ghee, and it is mixed with Abrak Bhasma. Nagarjuna Ras we have given, Shiva Gulika we have given, Ashwagandha Avlet we can given, Panchamrut Gugulu we have given, Shuddha Gugulu we have given, Hemavati Vacha Churna we have given. Again, Savardhan ghee Matra Basti with Abrak Bhasma we have given. And all the above treatment were used at a different stage of a treatment. It is not like that सभी treatment हमने एक साथ patient को दिया है। कुल मिला के 2 साल में इतना मेडिसिन हमने ये पेशेंट में यूज किया है और इसकी वजह से हमको ये रिजल्ट मिला है। स्लाइड आ रहा है ना रेग्युलर?
हाँ सर આવે છે।
કઈ સ્લાઇડ છે અત્યારે?
Here was listen.
Okay. So when we see the reports of this patient, we advised MRI scan with contrast for this patient after completion of 2 years of Ayurvedic treatment. So before treatment, there was a lesion at cervical C4 vertebra level, and ring enhancing lesion was there in the brain, which after Ayurveda treatment, the lesion at C4 level is markedly reduced, and all the previously ring enhancing lesion in the brain is also reduced. This indicates the remission of the disease. And it is important to note that in the latest MRI, there is some small new lesion is also found, but very important and very huge breakthrough is that the previous lesion due to demyelination is now significantly improved, and the patient is totally asymptomatic and with the use of Ayurvedic medicine. So now we will see the reports of this patient. I will show. So here you can see the this is cervical 3, this is cervical 4 lesion. I think this is zoom photo. So C4 lesion before Ayurveda treatment. Here in this area, okay. So you focus on this area. So this area, you can see it is a very shiny part, very shiny. So normally it should not be a shiny. The too much shiny, which says it is a demyelination is there in the C4 level of spinal cord. Okay, so this is before treatment. Now after treatment, a markedly reduced C4 lesion after Ayurvedic treatment. So this is the same plane, and this is the zoom of this. So this is C3 vertebra, C4. You can see this is becoming very dull in the color. Let's see previous. It is very shiny. It is very dull in the color, and also the size is getting. You can see the size here. The white, the thickness here you can see, and this area particularly you see. It is very much reduced here. So here you can see, and here you can see. Okay. So it was that was the spinal cord lesion. So now we have a brain lesion. Okay. So this is the ring enhancing lesion in the brain, which was there before our Ayurvedic treatment. Here as well, you can see one ring enhancing lesion is there. Here, white color ring enhancing lesion is there. Here also one ring enhancing lesion is there. This is the big one. This you can see. So here also is there little bit. So these all are the ring enhancing lesion, which was there before our Ayurvedic treatment. So this lesion shows that the myelin sheath is heavily destructed. Too much destruction or the extensive damage of myelin sheath, it leads to the plaque formation in the brain, which is clearly visible in the MRI here. Okay, so this was the before Ayurvedic treatment. This is the different plane. Here also you can see 1, 2. This plaque you can see big one, larger one. Here you can see. Here you can see. So these are the different section of the same girl before our Ayurvedic treatment. So in this, there is no reduced or previously enhancing ring lesion, which indicates the remission of the disease. So this is very important evidence when we speak about evidence-based Ayurveda or whatever the data or whatever you speak. So this data we must have. So then only we can convince the modern people or the common public that Ayurveda actually works. It is not like that we just make a tall claim that with Ayurveda we can do all these things. We have to do it and we have to show to the world. Then only people will start accepting Ayurveda. So these are the evidence that demyelinated, heavily destructed area due to demyelinated can be regenerated with Ayurveda. We have the evidence. Okay. So now we will see why we have used. I will now explain you what is the rationality or what is the reason why I have used specific those medicine in the case of this multiple sclerosis. So first, Abrak Basma. So majority of the Ayurvedic Vaidya thinks that Abrak Basma is best to be used in the Pranava Sota Vyadhi, or there is a Pranava Sota Dusti, Swas Ka, Chikka or whatever, in a lung cancer or whatever. But the main Lakshana or sorry, main guna of Abrak Basma, when we read Rasaratna Samussaya, it is mentioned that Abrak Basma is a Prajna Bodhi. And only this is the one Dravya in the Ayurveda which is Prajna Bodhi. Okay, so it is the only one Dravya in Ayurveda. Okay, so it is the only one Dravya in Ayurveda which is having Prajna Bodhi Gun, not even Suvarna or not even any caste density has this guna. So what is the meaning of Prajna Bodhi? So Prajna means to get, remember or to recall. Bodhi means knowledge or the thing. So Prajna Bodhi means remind the forgotten thing. So जो चीज शरीर का सेल उसका काम करना भूल गया है उसको याद दिलाने का काम अभ्रक भस्म का है. Okay. So it is best to be used in cancer and in autoimmune response where cell forgets their actual function. Just 1 minute. Okay. तो अभ्रक भस्म, तो प्रज्ञाबोधि इसका गुण है। प्रज्ञाबोधि में भूली हुई चीज को वापस याद दिलाने का काम अभ्रक भस्म करता है। ठीक है। कैंसर और ऑटो इम्यून डिसीज में हम सबको पता है, जो सेल है उसकी बुद्धि भ्रष्ट हो जाती है। तो वी कैन से जो कैंसर और ऑटो इम्यून डिसीज है वो उन्माद है, सेल का उन्माद है सेलुलर लेवल पे, क्योंकि वो अपना काम करना भूल जाता है, ड्रामा और नाटक करता है। ठीक है। इन कैंसर द सेल फॉरगेट्स इट्स नॉर्मल मेमोरी अबाउट डिवाइडेशन रेट। इट हैज टू बी डिवाइड फ्रॉम 2 to 4 and 4 to 16, बट इन कैंसर इट फॉरगेट्स। कैंसर में सेल की मेमोरी नहीं होती है, उसको मालूम नहीं है कितने सेल से कितने सेल डिवाइड करना है। और ऑटो इम्यून डिसीज में भी सेल को मालूम नहीं है कि कौन से सेल हमारे खुद बॉडी के हैं, कौन से हमारे लिए फायदा कारक है, कौन से नुकसान कारक है, किसको मारना है किसको नहीं मारना है। जब अभ्रक भस्म, व्हेन वी गिव अभ्रक भस्म, इट इंस्ट्रक्ट द सेल व्हाट इज योर रूटीन वर्क, यू मस्ट डू दिस, दिस इज योर वर्क, यू फॉरगॉटन योर वर्क, यू शुड डू दिस वर्क। सो multiple sclerosis is autoimmune disease, so we use abrak bhasma to get memory of neuron back, that which neuron itself should not damage the myelin sheath. Okay, so Vat Prakopa can happen due to two major factors, and we have the reference in Charak Chikitsa Vat Vyadhi 28th chapter. Either Dhatu Kshay can lead to Vat Prakop, or Vayu Marg Avran can lead to the Vat Prakop. So the avran of Vyan Vayu by Apana, Prana, Samana and Udana may cause the obstruction in transmission of the neural signal. So avran of Vyan Vayu due to other four Vayu as well as all the dhatus and other two dosha as well as the mala also. Okay. So when we read the Prana, Avrut, Vyan Lakshana, the two major features are given, Smruti and Balakshaya and Indriya Shunyatva. So Smruti and Balakshaya is nothing but impaired memory or the diminished strength. Okay, so this is Smruti and Balakshaya. This happens in the multiple sclerosis. Now इंद्रिय शून्यत्व, इंद्रिय जो है उसमें शून्यत्व आ जाएगा, इंद्रिय उसका काम नहीं कर पाएगी, न्यूरोलॉजिकल फंक्शन है, एम्पर्ड हुआ अंदर माइलिन शीथ का जो हेल्थ है वो इसकी वजह से हुआ। और मन जो है, मन को उभय इंद्रिय बताया गया है, और वायु जो है वो सभी इंद्रियों को चलाने वाला भगवान है। अगर वायु अच्छी क्वालिटी का होगा, है ना, तो ही मतलब इंद्रिया अपना खुद का काम अच्छे से कर पाएगी। सो मन बीइंग उभय इंद्रियत्व अनेबल टू डू इट्स वर्क नॉर्मली, दैट इज इम्पेयर्ड नर्वस सिस्टम फंक्शन। सो प्राण आवृत अपान वायु के जो दो लक्षण है, स्मृति और बलक्षय और इंद्रिय शून्यत्व, वो एमएस के पेशेंट से मैच होते हैं। इसलिए प्राण आवृत अपान वायु की भी चिकित्सा हम इसमें करेंगे तो फायदा होगा। ठीक है। And very interesting to understand here that Acharya Charaka has given in-depth description of avrana, Anyanya avrana and other this avrana, how to understand Vayu avrana. He has given description of this much size of avrana, and treatment only this much he has given. So only 3 treatment for avrana: use of Rasayan Dravya, Shuddha Shila Jatu and Shuddha Gugulu. So in this case patient we have used Shuddha Shila Jatu and Shuddha Gugulu for the treatment of multiple sclerosis. So Panchamrut Log Gugulu also we have used. This is from Vaishya Ratnavali, Mastiska Rog Adhikara. So it has Shuddha Parad 1 part, Shuddha Gandhak 1 part, Rajat Bhasma 1 part, Abrak Bhasma 1 part, Swarna Makshik 1 part, Shuddha Gugulu 7 part, Loha Bhasma 2 part, and the Bhavana is to be given with mustard oil. So this can be given as Pradhamanasya as well. In all the neurodegenerative disorders, we can use powder. We have to make a powder of tablet of Panchamrut Gugulu, and we can use as Pradhamanasya as well. So Savardhan group, I think many are unfamiliar with this Savardhan group. So it is taken from Sutrasthana of Kashyap Samhita from Lehana Adhyaya. It is indicated for children who is having retarded growth and undeveloped organ. So the Falshruti of Samvardhan Bhuta says Balanam Anganam Vardhanam. So the Bala Anga Vardhana, the name itself says Samvardhan Gri. So it makes the growth normal. So it is actually indicated for children, those who have retarded growth or undeveloped organ. Now, important point here is this ghee we can use in pregnancy as well. If a pregnant lady in the womb, the children is not having proper organ based on the duration of pregnancy, then we can give Samvardhan Bhuta to in pregnancy also to get a organ developed healthy. And also in the children. So with our Yukti, we have to do the Samvardhan of the neuron. We have to do Samvardhan of myelin sheath. So it will regenerate the myelin sheath. So we have used Samvardhan Bhuta Matra Basti with Abrak Basma due to Prajna Bodhi Gun. We can also give orally Samvardhan Bhuta or Abrak Basma as well. So apart from this, we can also use in multiple sclerosis Matra Basti with Maha Sneha we can use because it has all the 4 types of Sneha, Sarpi, Tel, Vasa and Majja. We can also give classical Basti, that is Karma, Kala and Yoga Basti. We can also use Nasya therapy in it. We can give Suvarna preparation, Gruhatvat, Rasraj, many Suvarna Basma we can use orally. And Suvarna Basma is Pradhaman Nasya also we can use. Okay. So I think this was the last slide, and we have shared all this thing, modern Ayurveda, how to approach, what is my logic behind using of each medicine. And last, I would like to say again that thousands of years of human observation and trial and error are far more greater than the 6 months of great experiments in the lab. And so we have to respect our Samhita and Shastra. All the Vaidya must read Samhita on daily basis, at least for 5 minutes. It is the only key of success in Ayurveda. There is no shortcut or there is no other way to get a success in Ayurveda. How much ever seminar or how much ever webinar you attend, how much ever you roam all around the world, in the India to various doctors. But unless and until you don't start reading Samhita and understand the Samhita, you will not be able to attain this good height in the Ayurveda. So Samhita is the only and available option to get a success in Ayurveda. Thank you.
Thank you very much, sir, for enlightening us. Now, further, we are move toward questioning session. All of you can mention their question in chat box.
थैंक यू सर. फर्स्ट क्वेश्चन है कि रेशियो ऑफ क्वांटिटी ऑफ अब्रक भस्म टू स्नेह इन मात्रा बस्ती. अब्रक भस्म की क्वांटिटी और रेशियो क्या होनी चाहिए मात्रा बस्ती में स्नेह के साथ, ये क्वेश्चन है पहला.
देखिए, आयुर्वेद में डोज के बारे में कुछ भी कहना मुश्किल थोड़ा होता है ना. फिर भी अगर एडल्ट पेशेंट है ना, वेट इज मोर देन 50 kg, देन I give 50 to 70 ml or 50 to 70 gram of Bhuta or Tela, and I will ask them to add 2 to 3 pinch of Sahasraputi Abrak Basma in that 50 to 70 ml of oil or Bhuta, and then we can give to the Matra Bhakti. And if orally we have to start, mean if the MH case is in relapsing case, then we have to give aggressive dose. Once the patient reach in the remission state, then we can give a low dose, maybe 1 or 2 gram per month. And if it is in remission, relapsing stage, we can give up to 10 to 20 gram of Abrak Basma also in 1 month. So that depends on the rog and rogi bulk.
दूसरा क्वेश्चन है सर कि CSF है सेरेब्रोस्पाइनल फ्लूइड, ये मज्जा धातु को हम कोरिलेट कर सकते हैं?
नहीं, ये तो स्नेह है ना, लेकिन आई थिंक करना चाहिए क्योंकि वो जो भी है वो ब्रेन के अंदर से ही वो उसमें वो है, तो और वो भी CSF उसके जैसा ही तो रहता है तरल पदार्थ. आई थिंक करना चाहिए. लेकिन वो द्रव स्वरूप में है, द्रव मज्जा धातु हम उसको ले सकते हैं, मस्तुलुंग जिसको बोलते हैं. आप अगर प्रतिशय का डिस्क्रिप्शन चरक संहिता में सिद्धि स्थान में पढ़ोगे तो उसमें लिखा है कि प्रतिशय अगर बहुत पुराना हो जाता है तो मस्तूलुंग नाक से गिरने लगता है. So that mastulung is nothing but the CSF leakage we have. So yes, we can say it is a द्रव स्वरूप of मज्जा धातु. Yes.
अब्रक अब्रक भस्म ओरल देनी चाहिए या बस्ती देनी चाहिए?
दोनों दे सकते हैं, लेकिन स्नेह दो जगह से एक साथ नहीं देना चाहिए. Either we can give oral tela or dhuta, or we can give through basti. But it is a thumb rule principle that at a time we should not give sneha dravya from oral route as well as from anal route.
Next question is, by vayu control and lipid given, we can improve myelin sheath, but MS is an autoimmune disease, so it further damage nervous system because of autoimmunity.
Yes,
Because
yes, that's
of
all.
autoimmunity. So question is how we can reduce autoimmunity. मतलब एक बार आके और दूसरी बार न आए तो autoimmunity कैसे हम reduce कर सकते हैं, ये क्वेश्चन है सर.
हाँ, वही मैंने डिस्कस किया ना. अब्रक भस्म का यूज हम इसीलिए इसमें करते हैं. जब कंटिन्यूस हम अब्रक भस्म शरीर के अंदर भेजते हैं, तो जो अब्रक भस्म का काम क्या है कि वो जाके सेल को ऑर्डर देगा कि भाई ये तुम ड्रामा कर रहे हो, बंद कर दो. तुम्हारा ओरिजिनल काम ये है. कैंसर वाले सेल को बोलेगा तुमको 2 से 4, 4 से 16 ही डिवाइड होना है, 4 से 50 डिवाइड नहीं होना है. ऑटोइम्यून में भी सेम अब्रक भस्म का रोल है. वो सेल को उसका मेमोरी बैक देगा कि भाई खुद के सेल को डैमेज नहीं करना है. तो अब्रक भस्म का रोल यही है कि रिलैप्स ना हो फिर रेमिशन के बाद, या तो हम फ्रीक्वेंसी रेमिशन की कम कर सकते हैं.
Next question is for kidney patient and for liver cirrhosis, any change for dose adjustment?
I think in this class we will discuss all the questions about neurological issue, because it will divert the topic, and we will have another classes which will be on kidney and liver disease. On that classes we can discuss.
Can give majja basti in this condition?
Yes, yes. Last slide I have mentioned the use of Mahasneha. It is mentioned in Charak Samhita and Ashtangradaya as well. It has Sarpi, Tel, Vasa and Majja. Of course, if the patient comes to us and if patient is eating non-vegetarian food, then of course we can advise bone marrow orally as well as Majja Basti also, because Sarvada Sarva Bhavanam rules will help in the improvement of the patient.
If children suffering from cerebral palsy can also should be treated with this approach of majja dhatu vikruti?
Yes, yes, yes. It is the Majjakshayi. Due to Vata Prakopa, maybe due to in the time of labor, or maybe the mother has done the extensive Vata Nidana. Of course, we can approach with the same principle.
मज्जाधरा और पित्तधरा कला है, उसका इसमें कुछ रोल है रिस्पेक्ट टू द आहाराज हेतु इन मल्टीपल स्क्लेरोसिस पेशेंट?
To be frank, I don't understand about Kala concept in Ayurveda. I am trying to understand what is Kala concept, so I cannot comment on Majja Dhatu Kala or something. I don't have knowledge about the Kala.
क्या हम सिर्फ गोट की ही मज्जा लेकर ये कर सकते हैं, और कोई भी आनु प्राणी की मज्जा लेकर बस्ती में यूज कर सकते हैं?
Any Majja will be beneficial. Ready-made Mahasneha is also available. In that, all four types of Sneha are available. Sarpi, Tel, Vasa and Majja, Mahasneha.
मांसपिंड स्वेदन दे सकते हैं?
मांसपिंड स्वेदन आई थिंक एट्रोफी अगर ज्यादा है तो देना चाहिए, है ना. मांस तो फिर ब्रूमण का काम करेगा. आई थिंक ऐसे इस केस में मेरे ख्याल से नहीं यूज कर सकते.
और कोई भी क्वेश्चन है ये सेशन के रिगार्डिंग? ये सेशन
प्रणाम सर. प्रणाम सर.
जी नमस्ते
सर, डॉक्टर पवन बोल रहा हूँ करनाल हरियाणा से. सर एक तो ये जानना था, अब्रक भस्म कितना आपने डाला, कौन कितना पुटी लिया, एक बार बस्ती का थोड़ा सा बता देते सर. वो कैसे कैसे कौन कितना द्रव्य हमें लेना है? फर्स्ट क्वेश्चन तो ये है.
मैं एक के बाद बताता हूँ. ऑलरेडी मैंने ये क्वेश्चन का जवाब दे दिया था. 50 से 70 ml हम कोई भी स्नेह द्रव्य लेते हैं, या तो मेडिकेट औषध सिद्ध घृता या औषध सिद्ध तेल, और उसमें और जब मात्रा बस्ती में जब हम अब्रक भस्म देंगे तब सहस्त्र पुटी यूज करेंगे तो अच्छा रहेगा, ओरली देंगे तो शतपुटी अच्छा रहेगा। पेशेंट अफोर्डेबल है, व्याधि बल ज्यादा है तो फिर ओरली भी वो देना चाहिए। तो 4-5 चुटकी अब्रक भस्म मात्रा बस्ती में देंगे तो भी काम अच्छा करेगा।
सर ये
सर
सर जो आपने संवर्धन घृत बोला, ये इसका रेफरेंस कौन से उसमें आया?
ये काश्यप संहिता में है, सूत्र स्थान में पहला अध्याय लेहन अध्याय है, उसी में है।
सर एक सिली सा क्वेश्चन है, आपने अब्रक बसम का बाई बस्ती देने का कैसे सोचा, कैसे दिमाग में आया ताकि हम भी ऐसे सोच सके आगे फ्यूचर में पढ़ने का कोई तरीका इंप्रूव करें?
संहिता ही आखिरी रास्ता है, पढ़ते रहिए, सब युक्ति अपने आप आपको आएगी।
नेक्स्ट क्वेश्चन इज, अगर रस औषधियां यूके में प्रैक्टिस नहीं कर सकते हैं तो इस कंडीशन में हम कौन सी हर्बल ऑप्शन दे सकते हैं?
देखिए, कोई भी बीमारी अगर इनिशियल स्टेज में है, व्याधि बल ज्यादा नहीं है, तो कास्ट औषधि से हम उसको ट्रीट कर सकते हैं ना। लेकिन जब हम कास्ट औषधि से फेल होते हैं, रिजल्ट नहीं मिलता, तो रस औषधि तो मस्ट यूज करना ही पड़ेगा, है ना। और आजकल जो संहिता में हमको जो भी द्रव्य के रस गुण वीर्य विपाक लिखे हैं, वैसे द्रव्य आजकल प्रदूषण के कारण हमको नहीं मिलता है। तो बुक में जो कास्ट औषधि लिखा है वो हम देते हैं तो रिजल्ट नहीं मिलता, क्योंकि बुक में फॉर एग्जांपल आंवले का जो रसगुण वीर्य विपाक चरक में या तो दूसरे निघंटु में सुश्रुत में बताया है, वो आंवले अगर हम आज हिमालय से भी तोड़ के लाएंगे तो उसमें वो रसगुण वीर्य विपाक नहीं मिलेगा जो बुक में लिखा है, क्योंकि ग्लोबल वार्मिंग है, प्रदूषण है, समय का प्रभाव है ना। तो मेरे ख्याल से कुछ डिसीज में रस औषधि ही सबसे अच्छा रिजल्ट दे सकती है ऐसे जटिल बीमारियों में। तो पेशेंट को आप इंडिया रेफर कीजिए, आपके दोस्त के वहां कोई भी सेंटर पे या तो गवर्नमेंट हॉस्पिटल में कहीं भी आप रेफर कर सकते हो। अगर ऐसी डिसीज है वो ट्रीटमेंट चाहिए ही चाहिए, है ना। अगर कास्ट औषधि से देना है तो महाकल्याण घी है, पंचगव्य घी है, चंदन आदि कषाय है, धन धान्य आदि कषाय है, फिर ज्योतिषमती तेल है, ये सब आप यूज कर सकते हो। वात हर कोई भी गुग्गुलू का भी उपयोग आप कर सकते हो, संवर्धन घी है यूज कर सकते हैं, है ना। तो ये सब ऑप्शन आपके लिए हो सकते हैं।
सर मात्रा बस्ती कितने दिन तक देना चाहिए, जैसे कितना, मतलब जैसे पहले 30-15 डेज या बीच में कोई गैप करना है या कंटिन्यूस चलना चाहिए?
मात्रा बस्ती का कोई रूल नहीं होता है, हम लगातार 3-3, 4-4 महीने भी दे सकते हो। लेकिन एक चीज का आपको ध्यान रखना है, आम अजीर्ण या तो विस्तृत अजीर्ण उत्पन्न नहीं होना है, क्योंकि ये स्नेह द्रव्य है, आप रोज दे रहे हो तो पेशेंट भी मुंह से कुछ ना कुछ बाहर की गलत फुलत चीज खाता रहेगा। तो अजीर्ण नहीं होना है पेशेंट को। अगर अजीर्ण नहीं हो रहा है, भूख अच्छी लग रही है, पेट साफ हो रहा है, अजीर्ण नहीं है, हृदय शुद्धि है, इंद्रिय अपना काम अच्छे से कर पा रही है, इसका मतलब आप 1 साल तक भी रोज दे सकते हो। अगर अजीर्ण है ना, आम की अवस्था होती है तो 2 दिन के बाद भी रोकना पड़ सकता है ना। तो आई थिंक ये मेरा आंसर है आपके लिए।
नेक्स्ट क्वेश्चन इज, रिलैप्सिंग टाइम कैसे कम कर सकते हैं? और ये डिसीज है वो रिलैप्स नहीं होगा अपनी ट्रीटमेंट से, आयुर्वेद ट्रीटमेंट से, मैनेजमेंट से?
यस, देखिए, ये जो मैंने अभी ये जो केस शेयर किया, वो 2 महीने से उसका ट्रीटमेंट चल रहा था, रिलैप्स हुआ तब वो हमारे पास आए थे। वो 2 साल के ट्रीटमेंट में एक भी बार अभी नॉट इवन अ सिंगल स्मॉल सिम्टम्स हैज रिलैप्स। और जब आप मेडिसिन की बुक पढ़ते हो मॉडर्न साइंस में इसके बारे में, तो ज्यादातर रिसर्च पेपर और रेफरेंस आपको ऐसा मिलता है कि मैक्सिमम 1.5 साल के अंदर एक बार तो रिलैप्स आता ही है। हालांकि इस पेशेंट के 2 साल हो गए, अभी रिलैप्स नहीं हुआ है। तो मे बी अगर भस्म कंटिन्यूस लेंगे तो रिलैप्सिंग की फ्रीक्वेंसी और इंटेंसिटी भी हम काफी हद तक कम कर सकते हैं।
मज्जापाचक का यूज कर सकते हैं इस कंडीशन में?
कर सकते हैं, मैंने नहीं किया है लेकिन कर सकते हैं।
परपटक को आप यूज करते हैं एमएस में, इन विच फॉर्म?
Perpatak, I haven't used, but I have read recently, just few days back when I was preparing this slide. There is a one good chemical this thing in the Perpatak, and it is you will be surprised to know that the 6 or 10 tablet is available for 15 to 20,000 rupees, and the main ingredients of that tablet is one of the chemical from purple. So I think if you do the Google, you will come to know.
दूसरा क्वेश्चन है, हाउ लॉन्ग मेडिसिन शुड कंटिन्यू एज अ मेंटेनेंस आफ्टर कंप्लीटिंग द कोर्स? कितने दिन तक हम मेंटेन कर सकते हैं, लॉन्ग कर सकते हैं मेडिसिन कैरी?
देखिए, मल्टीपल स्क्लेरोसिस इज अ वेरी, इट कैन लीड टू परमानेंट डिसेबिलिटी इन मेनी पीपल. So better we continue the treatment throughout the life, but we can reduce or increase the our treatment. For example, if patient is completely all right, we can give a matra basti with abrak basma every alternate day. If we see there is a chances of relapsing, we have to start again aggressive treatment. So I think like this.
क्लिनिक बंद कर.
I think no more questions.
थैंक यू सर इसको हमको ज्वाइन करने के लिए, और ये इतनी सारी जो भी इंफॉर्मेशन आपने दी है इसके लिए हम आपका बहुत बहुत धन्यवाद करते हैं. और ये सेशन के बाद हमको एक लाइन याद आ रही है, एकम शास्त्रम अधियानो न विद्यात् शास्त्र निश्चयम तस्मात् बहुश्रुतः शास्त्रम विजानीय चिकित्सक. ये सूत्र स्थान 4 का सुश्रुत का प्रभाषणी अध्याय का एक कोट है. मतलब कि सर हम लोग कोई एक रिस्ट्रिक्ट नहीं होके पूरे का पूरा साइंस का, पूरे बोथ साइंस का जो अच्छी अच्छी चीज है उसको कलेक्ट करके हम कैसे ओवरव्यू करें डिसीज को, ये हमको आज आपके सेशन के बाद के हमको पता चली है. और वी हैव टू एक्नॉलेज दिस टेक्निक टू डिकोड द डिसीज बाय बोथ साइंस. मतलब कि साइंस कोई एक का ही लेके और उसका उसके हम उसके ऊपर हम शाउट करें, ये अच्छी बात नहीं है. हमको उसका अच्छी जो भी उसको मेन कोर जो भी थिंग्स है उसको भी हमको समझना चाहिए, ना कि सिर्फ शाउट करना चाहिए. No one can restrict or set being orthodoxically attached to the what we have seen in recent practice. मतलब कि we have to be shashita, we have to be yokta like a sir. This kind of mindset we have to prepare in our clinical practice. We can please do not limit ourselves to some orthodox related disease by our Ayurveda fraternity or any pseudo people of having a Ayurvedic mass, यानी कि जो छद्मचार विद्या बोलते हैं उसको. मतलब ये इस सेशन का मेन ये एम, हमारा मेन एम यही है कि आप लोग, हम लोग सब अपनी प्रैक्टिस में जो भी हमको डिसीज हमारे सामने आए उसको हम युक्ति प्रमाण कैसे लगाए. जैसे कि सर ने आपको बताया कि मल्टीपल स्क्लेरोसिस कैसे ओवरव्यू कैसे करते हैं, वो कैसे अप्रोच कर सकते हैं हमको, और वो इसका मॉडर्न ट्रीटमेंट क्या है उस तक का भी हमको ख्याल होना चाहिए. मतलब पेशेंट हैंडलिंग में ये जो बातें है सब ये हमें ध्यान देनी चाहिए. मेन एम यही है कि हम कभी हम उसको अप्रोच कैसे करें डिसीज का. और एक एग्जांपल है कि हमारा जो पास्ट में कोई सचिन तेंदुलकर है तो वो इतने रिकॉर्ड बना सकता है, तो मतलब ऐसा नहीं है कि उतने ही रिकॉर्ड विराट कोहली बनाएगा, उससे ज्यादा भी बना सकता है. मतलब हमको अपने आप को अनलॉक करके और ऐसा थिंकिंग प्रोसेस माइंड में डालनी है कि मॉडर्न का जो पैथोलॉजिकल एरिया है, जो फिजियोलॉजिकल एरिया है, जो भी डिसीज का ओवरव्यू करने का जो भी मेथड्स है उसको भी साथ में रखेंगे, और हमारी थिंकिंग कैपेसिटी भी बढ़ाएंगे, और ट्रीटमेंट हम शास्त्रों के अनुसार करेंगे, शास्त्र में मिक्सोपैथी नहीं करेंगे. ये सब बातें हमको सर आपके इस लेक्चर्स के बाद हमको पता चली है. मतलब आशा रखते हैं कि अगर फ्यूचर टाइम में कोई भी ऐसा केस आएगा तो हम इस जो भी सेशन है वो इन सब से हम साझा करेंगे. मतलब धन्यवाद.
डेफिनेटली हमारा ये प्रयास रहेगा कि इसी तरीके से अलग अलग केस को मे बी मंथली एक केस या महीने में 2 केस हम कोशिश करेंगे कि इसी तरह आप सबसे साझा कर पाए. तो वी विल ट्राई आवर बेस्ट to share at least one case like this with all the modern and Ayurvedic background and how to select proper medicine, maybe monthly once. So we have created a WhatsApp group also, as you all know. So be there in that WhatsApp group only. We will be sharing all the future this thing in that group, and It is also my request that please join more and more BMS students and Vaidya all around the India so that they can get benefit of this thing and we can bring Ayurveda to the global. Thank you. Okay, Dhruji, we can now dismiss the meeting.
जी सर.